All right, good evening and welcome to all of you. I want to start by at least acknowledging the threat of Hurricane Sally, who is going into the Panhandle area and the Gulf Coast states. We understand that they could be impacted as early as this evening, and while they'll be impacted, we are hoping for the best for them. I'm reminded that we still have a couple of months to go in hurricane season ourselves, and so while we may dodge this particular storm, we certainly may have others. So our prayers go out to those families who will be directly impacted. My goals for each week are really about the same these days, but I'll review them in either case. We start with wanting to ensure that we will continue doing testing here within Orange County and making it widespread available to the residents of our county. We're also working with businesses and bar owners who we want them to safely reopen in our community. And just yesterday, the bars began the reopening processes. We will continue to offer programs designed to keep residents from being evicted here within our community, and we'll share more with you about that. Since the beginning of the pandemic, Orange County has a total now of over 38,000 COVID-19 cases within our community. We had an increase of 138 cases from yesterday. Since our last briefing on Friday, we have seen an increase of 446 cases. We have now lost 412 residents to the coronavirus. That is an increase of 11 deaths since Friday and 3 within the last day. Our hearts go out to those families as well. Our 2-week average is now 4.0%. Remember that this is just for the 2-week period of time. Our rolling average, however, is 11.4%. The rolling average means average since the beginning of the pandemic. Dr. Pino has joined us today, and he will likely offer caution on our optimism related to the numbers as they currently exist. So far, we have tested nearly 333,000 individuals in Orange County. Our health services team had great success going out to the Bithlo community yesterday at the Transformational Village. The team had an excellent response in this area with many people of all ages who were dropping in. More than 200 visitors and a total of 137 individuals took the test in the village there yesterday. We're proud of the community partnership that we have with United Global Outreach and Clean the World to make testing and other valuable services available to the east side of the county. Tomorrow, the team will be in the Conway area through Friday. They will be testing between the hours of 8 a.m. and 1 p.m. The testing is free and will occur at Barber Park, which is on Gatlin Avenue. You have to make an appointment at ocfl.net/Barber Park. And you can also pick up free face masks and hand sanitizers with your appointments. For all testing options, you can find information at ocfl.net/testing. When we talk about our CARES Act monies, they're really going a long way to help those in need within our community. Our COVID-19 eviction diversion program is still accepting applications from landlords and tenants to help with overdue rent payments. Remember, landlords and tenants must agree to apply together in order for the funds to be awarded. Hundreds of applications are being reviewed now on a daily basis. So far, nearly $130,000 has been paid to landlords since the program started last month. That means 42 families are able to stay in their homes and avoid eviction. Our business compliance strike teams were out for the first time over the weekend. They will be out again this coming weekend. So far, they have visited nearly 2,300 different businesses and have seen an overall compliance rate of 94%. They have re-inspected some 207 different businesses, and with the re-inspections, they see a compliance rate of about 84%. Today, our strike teams inspected Walt Disney World's Magic Kingdom, and it was found to be in compliance. Since positivity numbers are trending lower, we are announcing today that all of our Orange County parks and recreation playgrounds will be open beginning this coming Saturday, September the 19th. That means that all 118 playgrounds will be open throughout the county. Following the CDC guidelines, we ask that no more than 10 children be at or on the playground at any given time. There will be signs posted at each playground in English and Spanish, and you can see the signs there behind me. There's more information that can be gathered, again, by going to ocfl.net/parks. Also want to acknowledge Hispanic Heritage Month from September 15th to October 15th. We recognize the contributions and influence of Hispanic Americans in our history, culture, and achievements. We have some with us here today. One of our famed partners is Dr. Raul Pino, who is being recognized this evening, I know, with WUCF through a program that would take place tonight at 6:30 p.m. And I have seen him also featured by one of our local news stations. And so Dr. Pino has provided tremendous service to our community and other communities around America. And so we do appreciate his service. And we have my special assistant, Ms. Ilia Torres, over there. She's a rising star and an attorney in her own rights. And here within the Orange County Board of County Commission, we have 3 Latinas who serve with us each day as well. So to our Hispanic community, we congratulate you and we look forward to continuing to work with you. I'm going to turn it over to Mayor Buddy Dyer at this time.
Thank you, Mayor Demings. You know, it's been more than 6 months since COVID-19 first impacted our community, and just as is important then, now our individual and collective actions continue to remain critical to keeping our community safe and healthy. Keep wearing your mask, keep washing your hands, keep being diligent with physical distancing, and together taking these pandemic precautions. That's a term I picked up at the last press conference that I hadn't been using, but I kind of like that one. We can continue fighting this virus as a community. So a lot has changed over the last 6 months. So our city facilities, we shut down 47 playgrounds and 15 outdoor fitness stations back in March. And as we continue to reopen, we evaluate and plan for reopening of various facilities when we can do it in a safe way. So likewise, starting Friday, September 18th, to provide access for children to play and for residents to exercise, we will reopen all 47 of our playgrounds and all 15 of our outdoor exercise pods. Masks will be required to use them. People must stay 6 feet away from people that are not from their same household. People will be required to sanitize and wash their hands before and after use, and we'll be limiting playground areas to no more than 50 people at a time. And we will be sanitizing playgrounds on a daily basis. Quick update on our efforts to provide financial relief. Our rental assistance program in partnership with Heart of Florida United Way, since it's opened, has already received more than 1,600 screening forms. Funding will be provided on a first-come, first-ready basis, so residents who are interested in applying for rental assistance can complete an online eligibility screening form by going to HFUW, that's Heart of Florida United Way.org/Orlando Cares. Residents who qualify will be emailed an online application on Wednesday, September 23rd. Also, I'm pleased to announce another program that we're launching to support our businesses during the pandemic, which is a citywide curbside pickup program. It'll give businesses the opportunity to have more drive-through and to-go operations by utilizing existing parking spaces that are adjacent to their business as a temporary 15-minute curbside pickup zone, making it easier for customers and drive-up deliveries or delivery drivers to pick up from those businesses. If you're interested in participating in that program, go to orlando.gov/curbside pickup. And lastly, we continue to expand our testing opportunities. We'll be at Camping World Stadium again tomorrow from 9 to 1. Go to orlando.gov/COVID-19 for an appointment. Dr. Pino?
Thank you, Mayor. Thank you, everyone. Good afternoon. So I'm going to explain a couple of issues that are with the data can be complicated. So for the journalists, please feel free to ask. I know I don't have to give you permission, but so the first, let's give the data out. So we are a 96 positivity rate. It continues to be really high. Our overall percentage positivity rate is 11.4. And 5 deaths, unfortunately, were added to our listing on that category. And of course, our thoughts, prayers, and concerns with the families, friends of these individuals who were 61 to 93 years old, 1 female and 4 male. 4 have underlying conditions, 1 didn't. The little thing that I want to explain about this data, and I ask for forgiveness from the families of those who have died, because I'm going to talk about numbers, and your families are not numbers, but it's the only thing the way that I can explain it, is that some of these deaths has been reported late to us, for whatever reason may be. But for example, of the 4 deaths occurred prior to September 11th. And the last of those deaths occurred in September 11th. So we haven't had reported yet to us any after September 11th. And I'm saying this because in our prior press conference, we mentioned the fact that death rate was declining, and it was the last of the data to go in the right direction, and that continues to be the case. So what I want to highlight is, because we are receiving this late reporting, is also the fact that death rate have decreased and continue to decrease in our county. But I also want to highlight some concerns within the data. Yesterday, we received 3,038 negative tests, and we received 138 positive cases. That will give us a 4.3.5 average percentage. But this is the other part of the data that I want to alert you, is that after this report was published, we got a data dump from one of the labs. And that's going to add today 180 cases that you are going to see tomorrow reflected in today's data that is not there today. So what I don't want is anyone to think that we are hiding anything. Tomorrow, that data probably will be reflected. It will add 180 cases, or maybe a little bit less, depending on the cleaning that we are doing with the data. So that's happening. But our numbers continue to perform great. But we have seen a few things that we want to highlight. First one is that we are in week 38, and last week we continued to have a continued decline, and we have 8 consecutive weeks of negative growth. But that could not be the case this week. When we did these notes, those were before we got those 180 cases. So let me give you some things in the data that we are looking at it. It's first that the percentage of adolescents have increased. Although the data continue and the number to continue to decrease, the percentage of younger people have increased, and that was expected. Now, you could argue that this could be because the school activity has increased, and we mentioned that in the past, but it also could be, and we don't know, but these are the 2 competing ideas, it could also be that we are more actively looking for cases in that age group. As the students are engaged in classroom and we are isolating and quarantine individuals, all of these individuals are going for testing. So we are picking quite a few asymptomatic cases that otherwise may have not been tested. So that's our two comparing theories. Another concern that I have is that the median age continues to decrease, meaning the pandemic is starting to move to the younger age. And when that happened in the past, this is a group with a lot of social activities. So it's a lot of social interaction and moving in that age group around the county. So that is a concern, and we want people to be aware of that. This week so far, we had, without those 180, 323 cases. For comparison, last week, we have 446. So we should expect that this week, for the first time, our cases are going to be higher than the prior week in a while. And of course, bars are open, schools are open, visitations to long-term care facilities are open. So there is a level of increase of social activity, so that always normally we could respond with a little bit of increase on number of cases. But we want people to wear your mask, wash your hands, and watch your distance. Could you share the other data? So these are the weeks, and you see the continued decline. And week 36, we have a little bit of increase, but for the 8 prior weeks to that, we had a negative growth during the entire period, as well as last week of a 42% last week, a negative growth. Next slide. This one is our positive rate for the last 14 days without counting the testing that's done in the bubble in Disney. So this is the number that we were hoping always to get to 5. It's at 5.04. So this is it. This is probably the lowest that we can press this down. And with the whole World Health Organization definition, they consider someone will have this under control if you are below 5% positivity rate for the last 14 days. So we are there, and where it goes from here, it depends on how we behave in our daily interaction with our peers. Do we have a next slide? No, that's the last one. So that's the number that I want to leave you with. I have other data and many other elements that I would like to discuss with you, but it probably will come up in your questioning. Thank you very much. Mayor.
Check, 1, 2.
Okay, and if we have any Spanish-speaking media here who has questions in Spanish, we will call on Ms. Ilia Torres to assist with that. And where are we beginning today with the questions? I know that Ms. Lauren Seabrook always has a question for Dr. Pino, so why don't you come on up, Dr. Pino?
He knows me well. It's for you, Dr. Pino. Lauren Seabrook, Channel 9. Just wanted to clarify real quick. You mentioned the median age decreasing, but I don't think you gave the median age.
Sure, I
If you
believe
could
it's
give us that.
37, but let me double check.
37, okay. And then also just curious, when you talk about the numbers sort of creeping back up this week, and we also say we expected this, we knew going back to school, reopening bars, those types of things, we expect the numbers to go up a little bit. What would you consider a safe amount of going up each week, and when would you start to be concerned?
34 is the median age. The state is 37.
Okay.
That's what the one that I memorized looks like. So I don't know if we can establish a benchmark, but I can tell you that I'm pleasantly surprised that our numbers in the schools continue to be this low. And although we have a large number of individuals in quarantine, we have very few people in isolation. So quarantine is a preventing effort. It's let me put you outside of the group so that in case that you become infected, you don't infect other people. That's basically what quarantine is, the meaning of it. Isolation is, oh, you are infected, I don't want you to infect other people. That's why we are putting you aside. So the numbers continue to be low. Remember, we have 220,000 students just a student in our district. And I believe 14,000 teachers and employees, that's the number too. So our numbers are low, but I don't think that we can establish a benchmark. I think that it's not about the numbers, it's about how the transmission is occurring. We could have 3 people in one school, but if the transmission is occurring from class to another classroom, I would be highly concerned. We could have 3 students in one classroom, I will not be that concerned. If the students are isolated, we have a student chart, they wear a mask, and they were not interacting with other kids. So risk has to be assessed every single time. But I think that we are performing well for the school system. And the Board of Education had representation here. So if you have any questions, they probably could answer those.
Still no secondary transmission, though?
Now that we haven't been able to pinpoint, establish, and prove, to be honest. The first case, as I explained to you, in a private school setting, it was too close. It was right there, both 6 days. It could have gone either way, to be honest with you. It was too close for us to call. But we haven't seen major transmission in the schools. And to give you an idea, on Olympia, you know, that's the high school that was closed. It was a very wise decision by the board. I want to applaud the board for that decision. In the number of testing that we did both days, we picked 5 additional cases that otherwise would have stayed in the school and increased transmission. For that, I applaud the board and the superintendent.
Steve Hudak from the Sentinel. This is for both the mayors. Both of you have mentioned today that you're planning to open playgrounds and physical fitness areas. What led you to that decision? And the second part of that is, how will you enforce that people are wearing masks or observing protocols? And how important is that?
I think what, at least from the Orange County perspective, what led us to that decision was the fact that we have relatively low numbers. As you've heard Dr. Pino say, that the virus is relatively contained within our community. And there's this desire to get moving. It is outdoors, and I believe over time our community has demonstrated a willingness to follow the CDC guidelines. And so for those parents or guardians who may be at the parks or playgrounds with their children, we're dependent upon them to do the right thing, to follow all of those CDC guidelines and make certain that their children are wearing masks. And so this is a social experiment that we have underway. And so we'll just have to see if we find that there are outbreaks associated with any of those 118 different playgrounds within unincorporated Orange County, then we'll make adjustments. But we're testing this out at this time.
I would agree with that, with the numbers coming down where they are, and then the fact that we have really good compliance with our residents wearing masks and doing the social distancing. I think there's a learned effect that we can be successful in opening playgrounds and other exercise areas, and people want to use the playgrounds. I think most of the other municipalities in Central Florida have opened their playgrounds back up, so we're probably one of the later ones to the game in terms of that.
Hi, Emily Braun, News 13. This question's for Mayor Dyer. It's about the curbside pickup program for businesses. So can you explain a little bit more about what this will look like and kind of what resources this will add to the pre-existing resources that are already in place for businesses?
There'll be no permitting fee or anything. We just want to make sure that the space that's made available can safely be done. So if you have a parking space in front of your establishment, we don't want somebody taking that spot up for 2 hours. We're going to set up some signage that says 15 minutes, and that way delivery people or people that are picking up from the retail store or the restaurant or whatever can pull into that spot and use it. And we're just making those spots available to the individual businesses.
Danielle Lama with Box 35. My question is for Scott with OCPS, if you're okay with going up
I was about
there.
ready to introduce him, Scott Howard, the Chief Communications Officer from the Orange County Public Schools. He's here, and so any of those school-related questions, put him on the hot seat and ask him those.
So we were contacted by a family who have 3 kids in elementary school at Prairie Lake. They're all doing launch ed at home, and they say only one child has been able to get a device. Could you just talk about, are there kids that are still trying to get devices? What should a family in that situation do?
Sure, so making sure that they're in contact, obviously with the school, which they have been. We are experiencing device shortage, and this is a national issue. It's international because of the pandemic. Parts, repairs for devices and so forth has been an issue. We had a number of devices, obviously, that were issued in advance, knowing that cohort 7 and 8, which is our final 2 cohorts of device distribution, was accelerated. And during that time and over the summer, we allowed students to keep their devices at home. So what happened to, in this specific family, obviously it's impacting, but what happened was we didn't know that these devices were damaged, broken, until they returned to school and until some of them returned to launch ed. Once that happened, then it led to a series of them reporting damaged and broken devices, of which we used our contingency up very quickly. So we have a number of devices that are broken and that are up for repair, which we're going to work on as quickly as we can through that. We have devices that we know are ordered and are coming in. And what we're really wanting is families that can do launch ed from home with a personal computer, a family computer, and their student has a district-issued device, to turn that device into the school so they can redeploy that device to a family such as this that may not have a personal device at home. That's the best thing that we can do. We've put that call out through Connect Orange messages to our families, asking for them to volunteer. Once we get devices back in, we will reissue devices to every child. We don't want any child to not have a district-issued device, but right now, because of that worldwide shortage, we're really our backs are against the wall. We do know that we're getting it as quickly as we can out there to our families, and we'll continue to work with families just like that. Okay?
Jean-Pierre from Radio Haiti. Question for Mayor Demings. What is your evaluation since COVID-19 eviction programs start? Can you give us some evaluation about the program, COVID-19 eviction prevention program?
The eviction diversion program is going very well, and I'm going to ask my Chief of Staff to come forward, Ms. Roseanne Harrington. She can give you the numbers on how we're doing with the program. So, Roseanne, if you would just come up to that.
So, what was your question in particular?
Give us an evaluation how the program is going.
The program is going very well. We have over about 2,300 landlords that are in the process and about that many tenants in the process. And as the mayor said earlier, you have to match them. And we have about 760 landlords and tenants matched, which that's a good thing. So as they match, that means they go through the application process. And we have about 42 that have already received funding. 42 that have been moved on to the comptroller's office to receive funding. So we're moving through. It's taken about 2 weeks for the earliest ones to go from the first start where the landlord suggests they would like to be in the program, invites the tenant. They fill out their paperwork. It's reviewed by the Orange County Bar Association, reviewed by Orange County, and then moves to the comptroller. So it's a little bit over 2 weeks.
This next question was texted in for Scott Howitt from Sierra Putnam with WFTV. I believe she's referring to some of the athletes with OCPS. Her question reads, how many players were tested today, and were there any positive cases, and by extension, some games that will be canceled?
So we know that testing happened at 6 schools today, 3 in the morning, 3 in the afternoon. I don't know the exact numbers of how many athletes and coaches and training staff were tested during that time, and the final numbers as far as reporting of positive cases, that will be part of our update when we upload and update our dashboard. So that will happen tonight. You can look at the high schools and see which cases happen. I don't have a number to report out right now. I know they were doing testing this afternoon, so possibly have that information tomorrow. I do know that it will be updated in our dashboard as the intake forms are filled out and pushed forward.
Thank you. This next question was texted in for Mayor Dyer. This one comes from Ryan Lynch in the Orlando Business Journal. Mayor Dyer, for curbside pickup, will that apply to all city businesses or only those in certain areas? And
No.
does the city, and does the city have an expectation on how many businesses may participate in the program?
It's a citywide program, but obviously it can only be employed where we have on-street parking. So it would be limited to areas that have on-street parking, but it is a citywide, not a CRA type of program. And I don't know how many businesses will take advantage of that yet.
These next couple are for you, Dr. Pino. Nikki Ziza from WKMG. Her question reads, UCF reports they plan to test students randomly. Is that in conjunction with the Florida Department of Health? And if so, in what capacity is the Department of Health involved?
We are not involved in that testing.
All right. This next one comes in from Ashley Corin from WKMG. Dr. Pino, have any of the 115 cases in students or teachers resulted in hospitalization? Can you speak on the severity of the symptoms at all, especially in cases involving students?
So I will not know everything because I only know what is reported. But as far as I know, there has not been any grave illnesses in students. Has anyone been hospitalized? As far as we know, no, but we will not know all the cases.
And this next question is directed to you, Dr. Pino, and Mayor Demings from Steve Mort with WUCF. Are you happy with what you've seen so far in the bars that opened yesterday?
I have not seen the bars. I will have to go and visit maybe this weekend.
Mayor Demings, did you have anything to add? Or I guess Mayor Dyer as well.
Well, they just opened up yesterday, so in all fairness, we really have to give it a few days before we can do any type of objective analysis of the reopening.
This last question for you, Mayor Demings, from Michelle Meredith with West 2 News. Mayor Demings, the attorneys for the Salias Melvin case have asked the Department of Justice to investigate his shooting death by Orange County Sheriff's deputy. Do you have any type of response or comment?
I guess my only response is that I suggested that several weeks ago. I believe that in this case, given the complexity of what we know about that case, I don't know, it probably would be helpful to have a third set of eyes reviewing the situation and objectively reporting back. And I want to be really clear here that by having the Department of Justice review it, it's not an indictment of the deputy sheriff that was involved. In fact, it just may be helpful overall to bring in clarity to the circumstances for everybody involved. Okay. All right. It does not appear that we have any other questions at this time. Thank you all for being here, and we'll talk to you soon.